My name is Dr. Tariq Hakky, and I'm a urologist and I practice here in Atlanta, Georgia. My practice is called Atlanta Cosmetic Urology. I'm male infertility trained and I also practice general urology, but my focus is hormone replacement therapy, penile prosthesis, and sexual dysfunction, enlarged prostate, and other therapies like that. I wanted to chat with you about telehealth and telehealth visits, as well as a little bit about the COVID-19 virus. This new epidemic, this pandemic, has affected American way of life and has basically stolen your freedoms that you have for the most part. We have been asked to remain home and start social distancing for issues and reasons that we may or may not comprehend. Right now, we're going through unprecedented times, and I don't want to make this video, but I think we should, and we should talk about this. The CDC has issued guidelines for the COVID-19 virus to prevent the respiratory droplet infections by asking you to wash your hands for 20 seconds. If you don't have access to soap and water, then using hand sanitizer that's at least 60% alcohol based. We're also asked to clean off and disinfect areas that are commonly used to prevent transmission, like doorknobs and countertops. The CDC has also advised that people that are sick or people who are taking care of people that are sick wear face masks. We're also asking people to stay home if they are sick, and that's very important. There have been reports of COVID-19 virus parties where people are transmitting the virus. There are patients that have been tracked back to half of the infections in South Korea that have just ignored warnings to stay home. This virus is not like the flu. It is far more deadly, and our healthcare system right now is already stretched to its limits. And if we have an influx of 1% of people of the United States all of a sudden need ventilators, we're going to have to make some tough choices as Americans and as healthcare providers about what we do. So the reason that you're staying home and the reason that we are, as healthcare providers, canceling all cases is so that we have personal protective equipment. This is really important because we're fighting a war. This world war isn't with bullets, and there is no Nazi Germany. Our enemy is a microscopic, invisible virus, and the bullets now, they're personal protective equipment like masks, gowns, gloves, cleaning equipment. These are the bullets that we need. And during the elective surgical cases, we use machines to keep people asleep. Those are the same machines that we may need to and will need to use to keep people that are having respiratory failure or trouble breathing from bad pneumonia from this SARS virus epidemic with COVID-19. It's important for us to come together as Americans and as humanity to see that, while we are giving up our freedoms in the short term, we are doing this for the greater good. And while the economy may take a hit, it will bounce back. And it's wrong for us to say and ignore the fact that other Americans may be suffering and other parts of the country may be affected, and it doesn't affect me, but it will affect you. This virus is spreading and it's very infectious. The fact that we're running out of ventilators and personal protective equipment, some people are sounding the alarm. We're also getting misinformation, which is why I believe this video that I'm putting out is important for us to hear, that we should not be hoarding medicines. And I'm hearing reports that physicians are sometimes taking Plaquenil, which has no clinical trials backing that it would even help prevent this infection or help cure the SARS infection that you would get from the COVID-19 virus. We need to come together and use what we do know. And what we do know is the hand washing, the social distancing, and canceling the cases that we have to save the precious bullets, which are the personal protective equipment for other people. Now, in this time when we're social distancing, we need to be able to have access to patients, and patients need to have access to us. So telehealth has grown. In Atlanta Cosmetic Urology, we're using a platform called Doxy.me. And that platform is very easy to use. We send a text message or an email link to a patient. There's no software that needs to be installed. And this will allow the patient to quickly be video broadcasted right in. Now you may be concerned about, I don't want to install in software. There's no software to install. You just click on a link and you arrive in my office or in your healthcare provider's office, and you can see the person right there and figure out what you need to get done. Well, I don't know if it's covered. Medicare is covering these. There are certain criteria that must be met that are available on the CDC website and also on Medicare.gov website. The private insurances are covering these visits as well. These visits are easy to set up, they're safe, and they continue the social distancing mandate that's important for us as Americans to continue. I think that this is a really important way for us to still reach out to our patients and our patients to reach out to us. At the bottom of this video link, I'm going to put a link into our doxy.me link so that you can see what it looks like. And also I'm going to leave a telephone number for patients to text message during business hours to make appointments with us. These are unprecedented times for us as humans and Americans, and nobody has lived through anything like this. But the decisions and the sacrifices we make today will change our future and change the people and help our healthcare providers make the decisions and have the equipment that they need to get through this. But for now, if you have any questions, please post it in the YouTube link below. Thanks.